coronavirus cases and deaths are going up in parts of the country, largely, epidemiologists believe, because of the Delta variant. Dr. Mallika Marshall joins us now. And doctor, just a week ago, the Delta variant accounted for 25% of the infections in the U.S. Now it's more than half. Why is it spreading so fast?
I know, it's crazy, right? Well, first of all, the Delta variant is estimated to be about 50% more contagious and possibly more severe than the Alpha strain of the coronavirus. So, for example, a Yale epidemiologist said in an environment where no one's vaccinated or wearing masks, that someone infected with the Alpha variant might infect 2 to 3 people around them, whereas with the Delta variant, it might be somewhere more like 3 to 4 people. So the virus can spread like wildfire in those communities that have low vaccination rates, and those are the same areas that could actually become breeding grounds for other variants to emerge. So we got to keep an eye on that.
So a viewer named Dana reached out to ask you, doctor, if fully vaccinated people are protected from this strain, and you have some new information.
Yeah, so researchers in Israel are now reporting that the Pfizer vaccine is only about 64% effective against the Delta variant. Now, it's not clear why that number does happen to be considerably lower than several other studies that have found the vaccine, on average, is anywhere from 79 to 88% effective at preventing infection with the Delta variant. One possibility is that Israel does more widespread testing, so they may be picking up more asymptomatic cases. But I think most studies, including the Israeli study, say that the Pfizer vaccine and other vaccines are highly effective at preventing hospitalizations and deaths, which really is what matters most.
Yeah, because that gives you a shot at staying out of the hospital, right?
That's right.
And getting severely sick. So what advice would you give to people who are understandably concerned about this Delta variant?
Okay, so I would say if you're fully vaccinated and you're in an area like Massachusetts with very high vaccination rates, that you really don't need to worry. You still should be very well protected. But even if you're vaccinated and you travel to a region of the country with rising coronavirus cases, just be careful. Consider wearing your mask when you're in crowds or in closed spaces. Of course, if you're unvaccinated, you need to get vaccinated as soon as possible. Continue to wear your mask in public and socially distance, because you are at very high risk of getting sick from this Delta variant.
It's so important if you're traveling to areas that don't have high vaccination rates.
Yeah, I would say be careful, especially if you're at high risk. If you're an elderly person or you have an underlying condition that puts you at high risk, just be careful. I'm traveling to a place with low vaccination rates, and I think I'm going to be wearing my mask a little bit more than I'm doing here.
Read the room. I still read the room and bring my mask.
That's right. Why not?
Doctor, thank you so much as always. David?